Good afternoon, everybody. Thank you for being here. Let's go over some numbers and brief comments on some other topics related to COVID and restart. Then we can take some questions. Good news, no death over the weekend, over the last 24 hours. So that's certainly very, very happy about that. As we've seen in this pandemic, the virus preys on those who have pre-existing conditions, especially hard on individuals over 70. We've seen certainly when we look at our numbers, we've lost many of our neighbors who've lived in facilities as well. And so, we just, anytime we're up here not talking about this, that's a good thing. Looking at some of the testing data, 807 tests yesterday in Onondaga County. Over the weekend, the region had over 5,200 tests, well above the mandate. That's important that we continue to test rigorously. It helps us find hidden pockets of COVID throughout the region, and also it gives you a sense of where the infection rate really is in the community. So that's very good. Hospital numbers, 16 in the hospital. This is the same as yesterday. We have 5 individuals who are waiting a test to be released back to their home, a senior facility. So we have 11 individuals in the hospital receiving hospital level treatment. We have 5 individuals who are what we consider in critical condition. Certainly, let's please keep them in our thoughts and in our prayers. We need them to get well. Overall, our hospital numbers are as low as they've been since March 26th during the pandemic. To give you an idea, we looked at some of these numbers earlier, but on March 25th, we had 9 individuals in the hospital, and then in one day, we had 7 new people go to the hospital. That's in the beginning part of this process, the pandemic, what was happening. It was moving very, very fast. People were getting very, very sick. Now we're on the other side. Looking at cases, 3,454 cases since March 16th. That's up 4 from yesterday. So 4 new cases, very good day, 0.49% infection rate on the day, very good numbers. What's even better about them is you look at the tracing, you quickly can figure out who's who. 1 household contact of a previously confirmed case, 1 from a senior facility, 1 was related to travel, and just 1 case of community spread. Certainly, I probably would have to do some digging to see last time we had 1 case of community spread. But good data. Overall, our infection rate on a 7-day average is 0.8%. It has been that way now for essentially a month, under 1%. Sometimes it's 0.7, sometimes it's 0.9, sometimes it's 1. On average, we've seen 0.8 for a long time. So to put that into perspective, out of 100 people in a room, 0.8% of a person, or round up 1 person, may have COVID. So certainly March 26th, going back to that date, because I'm going to reference that date a couple times, our infection rate was over 7%. So we've come a long way. We are presently monitoring 113 active cases. That's down 12 since yesterday. Lowest case number since March 26th. So that's again 10 days after our first case. That's where we are. So essentially, as we get new cases, we'll still get new cases. The virus is here, but at the same time, we're getting people almost recovered at the same pace at this point, which is good. And so again, I want to thank our county health department for all the work they're doing. Dr. Gupta, led by Dr. Gupta, just really remarkable work. 24/7, and these are the best public servants you could ask for. 3,145 people have recovered of COVID. That's up 16. When we look at the caseloads, 2,004 have been female, 1,450 have been male, 273 have been under 19, 668 in their 20s, 468 in their 30s, 419 in their 40s, 511 in their 50s, 400 in their 60s, 296 in their 70s, 261 in their 80s, and 158 in their 90s. Since we last got together, the governor had a press conference announcing the reopening of schools on Friday. When you look at our 7-day infection rate, we touched on that, 0.8%. Certainly one of the best in New York, but also certainly the country and the world, if you think about it. And you think about what we've accomplished together, we've essentially made our community a very safe place. The governor's worked very hard statewide. We've all worked very hard in our region. And if you think about a bubble within our own community, the infection rate is so low that people want to come into the bubble. And when you look at kids coming back from SU, what do? We test them coming in. We know that they are negative. They come in, we test them again. And then what do we do to mitigate the risk of COVID from a 0.8 starting point? We wear masks, we sanitize, we physically distance, we test, and then we trace when we find it. And it's working. And when you put all those together, very effective at starving this virus is what we need to continue to do. A reminder that every step of this process, there's been anxiety. And every step of the way, we've brought people back together, but we've done it in a different way than where we were before. We've been smart. And because of that, with every reopening of part of our economy, the infection rate has gone down, and now it's gone down and stabilized to a point where I'm not sure how much lower it can go. Within the 0.8%, we've even absorbed a potential threat to our infection rate with traveling. We've heard the governor talk about it. We heard the governor talk about and implement various policies with quarantines from outside the community coming in, or if you're going outside the community and you come home. Within all that, we've had cases, and we've absorbed that, and it hasn't pushed our infection rate to a higher point than where we already were. So that very, very good news. A couple other data points I think are relevant as we start thinking about going back to school, and we'll talk about some of our conversations we've had. Since the beginning of the pandemic, we've had 175 cases out of our 3,450 that have been related to school-age children. Most of those cases, as we know, being some of our more social young people, our teens, and we talked a lot about that around July 4th, the week going in and out of that. When we look at children ages 5 through 9, there have been 21 cases since the pandemic, or 0.6% of all cases. Certainly, luckily, we have not had any individuals in this age group or demographic succumb to the COVID-19. But that's important that we talk about this. And when we look at the kids, what do we know about the kids? What we know is that kids can get COVID. Kids can spread COVID. The infection rate in our community is very low. And because of the behaviors of different demographics, they're more likely to find these pockets of COVID. So what do? We're now working with our school districts for plans for testing and contact tracing. The county health department is in charge of contact tracing. We will be running all these operations. We will work with the medical teams and the nurses in each building, but that is our responsibility. Any potential case in schools or colleges will be done by and led by the county health department. With districts, we had a call on Friday, shortly after the governor's announcement, with the superintendents talking about testing. And we are talking about a back-to-school testing effort, voluntary, with employees first. Again, 95% of the cases in our community have been individuals who are not school-age children. So we know that the numbers tell us there's more risk there. So how do we make sure that we mitigate that risk? We'll test the employees, and we'll work to do that in a timely fashion, utilizing our rapid testing infrastructure that will be in place and is already being put in place as we speak. In addition to that, we'll work with the districts as the high schools start to come back. Each plan is different, and each plan may have high school kids coming back a certain number of days per week. Certainly, when you look at outside the adults, the second demographic that is really found this virus has been our 16, 17, 18-year-old kids. So let's test them, and let's work with the districts to get these kids tested going into the school year. And then we're working. We have not finalized plans yet, but we're working on tracking the virus throughout the year in the buildings. There's a couple things that we hope to finalize plans with the districts on that we're working on. Certainly, it's very easy to put together protocols if someone comes in who is symptomatic for a rapid test. That's easy. We're looking at some other ways of being more proactive, and certainly we'll partner with our districts on that to make sure that we continue to make sure that school is as safe as possible for the children and the employees. So very happy to take questions on that later. Control room today, we talked a little bit about the court case that came out on Friday related to weddings, and so certainly that's something that I think the state's going to look at their legal options. That essentially right now our interpretation is that weddings are now allowed at 50% capacity. So if there's an appeal and that changes, we'll let you know, but our county attorneys are working on an opinion for us. I think it's been reported about that, but certainly for those who are looking to get married, this is and have a reception, this is good news. This has been something we've been advocating for. We would still highly recommend people to do testing, especially if you have out-of-town people coming into the wedding. We have rapid testing capabilities and capacity that's coming up, but we think that's important. And certainly all the other guidance related to restaurants as is will apply. There still will be no music or dancing, but you will be able to have a larger reception, as is the law today based off of the federal decision. A lot could change with that, so we need to stay tuned on that. Again, we reiterated our offer in Central New York to be a pilot community for gyms to reopen safely. Let's put regulations on. Let's have our health department regulate. Let's look and see what happens. And certainly, I know we've gotten a lot of feedback from individuals who go to gyms that are very excited about the opportunity potentially, as well as the business owners. Again, we would not advocate for anything if we didn't think it could be done safely. And then bowling alleys is another one that are still on the sidelines. These bowling alleys live off of the leagues, which really happen after Labor Day. We've asked the state of New York to take this into consideration. Let's again figure out a way for this to happen. Let's figure out ways to put regulations on. What are the concerns? Other states have opened up bowling. To my knowledge, there hasn't been heavy upticks in cases with this. Certainly, let's figure out ways to regulate it and then get these businesses open. It's important for the businesses. It's important for people's mental health that things they do and love, when the infection rate is as low as it is, that they get those opportunities, even if they are limited now compared to where they were in 2019. Looking at stimulus talks in Washington, D.C., obviously they broke down at the end of last week. There's small signs of hope that they might start up again. We really have run out of time as far as waiting. We need to start making decisions and asking our legislature to give us the flexibility we need to deal with this mid-year budget crisis. We've cut related to spending lines, early retirement incentives, holding vacant positions, part-time positions, and now it's at a point where if we don't get help, that's not enough. So later on this month, I'll be asking the legislature to give us flexibility relating to cutting workforce hours. If we don't need to cut those workforce hours, that's fine, but we're going to be asking the legislature for that approval so that we have the ability to move in real time. And certainly if our friends in the federal government come through, this won't impact families. If they don't, it will. So remind people, we're looking at revenue losses that weren't our fault. We were asked to shut down our economy. We did it. Then in addition to that, we're looking at mid-year state budget cuts of $20 million. So when you're looking at the revenue loss, mid-year budget cut, if we weren't looking at those two items, we would have had our third straight budgetary surplus as we did in 2018 and 2019. So saying that, I'll take questions.
There's been, over the past few hours, there have been some confusion from the governor's office regarding, he called out 107 school districts stating that they didn't submit their reopening plans. Now, some schools have gotten back to us in Central New York telling us they have. What are your thoughts on that, including FM, who is now telling us that they have, kind of submitted their plans correctly? There's just this confusion going on right now with school districts, submitting their plan correctly.
Yeah, so in our control room call, we were told there was 4 districts in all of Central New York that had not put in their plans. Fayetteville Manlius was one of them. My understanding is Fayetteville Manlius has put in their plan and that they now have an acknowledgement of receipt from the state related to that. So that's good. Let the state review the plans. Certainly, it seems like whatever it was, some sort of error. I can't speak to the 3 other districts that are not in my county, but certainly happy that FM has put their plan in.
Ryan, when you're talking about the 4 new cases, I think you said 1 was community spread, and I couldn't hear what you said about the other 3.
1 was travel related. 1 was a senior facility, and then 1 was a household contact of a previous confirmed case. So again, we're looking at 3 out of the 4, some sort of contact tracing. 1 was in quarantine already. So from a workflow standpoint, pretty good day for the health department, and certainly 1 community spread. We've always viewed that as being the randomness of the infection, representing the greatest risk to the community. Not that there's ever a time, we know with senior facility cases, those are quite often worse because there's a direct correlation with those cases and hospitalizations. But for the most part, residents in the senior facilities have not had a lot of interaction with folks outside of the facility. So overall, 4 is a great number, and happy that 1 community spread. That's a really nice number. Hopefully we'll keep the infection rate. Again, there wasn't as many tests that came through as normal, 800. Normally we're getting 1,500 or so a day. But the infection rate of 0.49, if we can get that close to 0.5 every day, we're going to be in good shape.
Can you clarify the amount of school-age cases the county has seen again?
Yeah, school-age cases total have been 175, most of those being your teens. Out of the 5 through 9, your elementary school numbers, we've had 21 cases, and we believe actually 21 out of the 21 are related to household contacts.
There was a report that came out that nearly 100,000 children contracted COVID just the last 2 weeks of July. Does that concern you? That number concern you at all, or are you pretty confident with the county? Yeah,
we've had teens getting COVID, and we know how, if you're social and you're not physically distancing or wearing a mask in groups of friends and somebody has it, it will pass. And so I think when you look, it's very difficult to compare what's going on in a Georgia or a Florida or an Arizona or a Texas to New York State right now. Very difficult. We have an infection rate under 1 statewide. Our region's been consistently around 0.8, a little bit under 0.8 on days. So, but that doesn't mean kids can't get COVID. If somebody's symptomatic or a kid is not symptomatic, they're asymptomatic and they have the chance to spread it like any other person. What we know is that whether it's an anomaly or not, the data shows that the individuals that have gotten COVID have been adults for the most part in our county. And then with the household contacts spread to the younger kids. The teens have been more active like adults, and they've had more social life like adults, and so they've gotten the virus more than the younger kids. So we start out at a very good place at 0.8%. That's a very good place to start out. Then what do you do to try to build off that, especially related to going back to school? We'll test everybody, the adults, and then we try to test the teens, and then we put in protocol with testing strategies throughout all the buildings. And when you do all that, you get that risk down more than 0.8%, but there's no 100% risk-free technique in COVID. It doesn't exist. So that's the reality. That's what it's like when we're living with this virus.
What can you tell us about these home repair grants for Onondaga County residents impacted by COVID?
What are you referencing, Jay?
I think there was a news release that there's going to be some announcement tomorrow between you and home headquarters.
Oh, yeah. Well, I'll have to get. I'm not sure exactly what program you're referencing. I know that we're looking at various HUD money. I think there's other private sector dollars that are being invested to try to give families who've been impacted by COVID opportunities to make repairs to the housing stock. I'm not sure exactly. I don't want to get out in front of my skis on an announcement that may not be mine to make completely tomorrow. So we'll have to keep you guys busy tomorrow too.
Can you expand a little bit more on schools and testing and tracing? I know you mentioned that the county is in charge of the tracing part, but what's that plan look like so far? I know it's still in the works.
Yeah, so we'll just think of it this way. So we've had 3,454 cases where we've done this. This is not new to us. The contact tracing for a 4-year-old or a 40-year-old is the same. We are immediately going to look and try to figure out when you develop symptoms of COVID. We look back 2 days. We then go through your direct contacts through all your calendar and try to figure out who had direct contact, who then needs to go into a quarantine so that we can box in the threat and isolate the threat. So we will do that with the schools. We will know before the schools who's positive with COVID-19 in their building. Then we will need to figure out, it's probably likely at some point there will be a parent who has COVID and who has a kid who is in school. So then Dr. Gupta and her team will do the investigation and determine how many of those students in that class have to go into a quarantine. And then eventually there will be a case in a school. It's math, right? And so then at that point, does that mean that the classroom goes into quarantine, or more than the classroom potentially? That will be Dr. Gupta and the health department's call based off of the circumstances for that specific case. But contact tracing with schools is no different than contact tracing with any other employer. And certainly with any situation with COVID, you are not going to take a laissez-faire approach to quarantining. You're going to be more aggressive than normal. And right now, still, we have 113 active cases. We have 577 people who are in quarantine still.
So does the county plan on having the school districts and the teachers, the adults who work in the schools, test before going back to school?
We're offering a testing program with all the districts where all the employees should be tested going back. That will be the employee's decision, though. But we've heard from employees. Some are anxious but want to go back to school. Some are anxious, don't want to go back to school. Many just want to go back to school. Regardless, when we're talking about risk mitigation, the best way to know that to drive down that risk from 0.8% down to as close as you can to zero is to test the people going into the buildings. And that creates a separate bubble around that building for a period of time. That doesn't mean the virus still can't get there. That's why you have to take precautions and ongoing testing protocols. But certainly, if you look at Syracuse University, the students coming back, we had them all tested before. and you can't come back unless you have a negative test. Guess what that did? There were students that tested positive. They're not back in the community. We think the same strategy with going back to school with the adults and with a lot of the teens will and can be effective.
Where are you at with the county with the child care solutions as families are starting to have to make decisions about remote learning as early as this week?
Yeah, this is a real big issue. Certainly, there's the slots of traditional childcare will probably be taken up quite quickly. And so what we need to really see is, again, it goes back to some of these federal talks with the stimulus funding. Things that both parties agreed to in the House and the Senate were money for back to school and then money for childcare. So certainly that would help solve some of these issues for districts to partner with some non-traditional centers to do some things. We're looking at various options within our own facilities, including this facility, potentially about a safe place for our at-risk students to be here in a safe way. That would need to be a partnership with the school district and with the parents to do that. But certainly we're looking at all options. It's difficult to make these plans and commitments when we don't know where the money's coming from at the federal level, because the school districts are still under the same pressure from the state of New York that we are. They're still potentially looking at up to 20% cuts. Certainly their ability to do proactive things if they get caught is the same as ours to do proactive things if we get caught. That is, we don't have a ability to do much.
What's the current situation with testing results, delays locally? I know we saw the delays decrease and then they picked up again as we saw this national surge. What's happening now?
Yeah, so the nationally, your national labs are now taking preference with symptomatic cases, and so those turn times are better. Certainly our local labs and our state labs are doing much better. And so when you look at upstate, some of their turn times are very strong, 24, 48 hours. And what we have coming into play soon is a new partnership, and where we'll be doing more of our rapid testing. That Roche machine is coming in very soon for upstate. This will give our community a level of capacity and turn times that it will help us deal with the virus right now in real time, but also will help be a tool for us to be more confident in opening up our economy to larger gatherings, because we'll be able to test quickly to know that people don't have the virus. So I think we're in a much better place today than we were. I think the backlog of those folks 4 or 5 weeks ago who went testing asymptomatically and were waiting on the national labs, I believe most of that backlog has finally filtered its way through, and now the testing times with the partners at the national labs is better, but certainly our local and state labs is very good.
Speaking on the term of testing, just going back to school testing, those are a lot of tests and a lot of people work in the school districts throughout Onondaga County. So my question is the school district going to be paying for those tests or the county? Or how's that going to work?
Yeah, so the way we view this, and I'm sure my insurance company friends are going to love me for this, but we view that there's risk with all these folks going back to school. So we essentially are going to, we believe these are almost symptomatic type tests that need to happen to ensure a safe start to the school year. So we believe insurance should cover this. Certainly when and if a provider decides that they shouldn't, we'll address that. But for us, this is a really important step to mitigate risk. And so we're going to make sure it happens, and those that want to test, get a test. It's going to be a lot of planning with our emergency management department, a lot of planning with some of our different providers, But we believe that we can get it done and get it done quickly with the results back, and that the insurance companies will cover the vast majority of it. If there's a gap, we'll work with the districts and deal with it.
On a different note, there's been a lot of talk about mail-in voting. Do you personally trust mail-in voting, or do you think it's susceptible to fraud like the president has been saying?
I haven't gotten this question. Holy. Your traditional absentee ballot voting, I think, has been done for a while. I think what we have in New York isn't what the president is alluding to, which is ballot cropping, which could be more problematic. So I think we're good in New York State. Other questions?
The algae bloom on Skinny Atlas Lake, can you confirm and talk about that a little bit?
Yeah, so it looks like there's a small bloom that SLA detected. Certainly when you have the weather conditions that we've had this year, dry, hot weather, prone to blooms. We've seen blooms in Jamesville, where we've had to shut down the beach a couple different times. So it's something that in September might be more of a threat, but our health department and certainly the city of Syracuse, SLA, we're all watching this. This is a result of Mother Nature. Not much that we can do except for proactive, preventative investments that we've been making, and that we'd be happy to talk about more. And certainly and then the EEE virus, certainly in Cicero, Oswego County, we're certainly going to be doing spraying on that as well. So these are all things that, other things that our health department does besides COVID-19, and that we're always working on and keeping our eye on. Other questions? Thanks, folks. We will see everybody back on Thursday.